recording. Okay. All right. So this is Carol Roberts, one of the founders of Grokking Wholeness, and I'm here today with a very dear old friend I'm very excited to introduce you to. His name is Dr. Eli Kolp, Kolp, and he's been a psychonaut for many, many years. He is a board-certified psychiatrist and has been doing psychedelic therapy for decades. In fact, he's written chapters in textbooks on psychedelic medicine, and he is the real deal. So without further ado, I turn it over to Dr. Kolp, and you can tell us whatever else you wanted us to know about you.
Thank you for inviting me to your podcast. I am very treasuring our time together and mutual work. Uh, and in fact, I just returned back from ketamine workshop for professional, which was a very gratifying experience because it was close to 20 different practitioners, and all of them are practicing ketamine psychedelic psychotherapy in some form or another.
Tell us
Uh,
about ketamine. What is ketamine?
the ketamine is originally designed as anesthetic. However, unlike majority of anesthetic, it doesn't really extinguish consciousness, but quote unquote dissociate it, pulling it out of the body. And subsequently, when it's done in low dose, or frequently after anesthesia is over and the level of ketamine in blood go down, people start having very intense visionary experience. In fact, majority of people who try LSD, they clearly say that it's in some way more powerful than classical serotonergic psychedelic like LSD or psilocybin, which frequently create vision. They're very bright and kaleidoscopic and pleasing the eye, aesthetically pleasing, but very frequently they're defragmented, there is no real story, they're frequently changing, which may be not bad for psychotherapists. It's almost like having visiting the dreams of the customer. But unlike those fragmentary vision, ketamine, 9 out of 10 present really some kind of coherent story, with the beginning and the development and climax. And from that point of view, it's more impressive for people who are having that the transpersonal experience, hallucinogenic experience. In addition, not only it can bypass people who stuck on serotonergic antidepressant, it can also uh, causing very frequently so-called near-death experience and transcendental experience, which, in my opinion, they're more fascinating and more susceptible for the treatment than the empathogenic state or out-of-body state. Uh, of course, it's disputable. Lots of people do opposite. They believe that the intense psychedelic experience is basically just acute hallucinosis and should be avoided as much as possible. And it's better just to work with the pleasant emotions without disturbing that the deeper access to the unconscious mind. Well, there are cons and pros for both technique. And of course, personally, since I've been concentrating on psychedelic psychotherapy, I see some application for that empathogenic psychotherapy, but in my mind, they're rather limited. Observed now people for many years, and I have been consultant for many physicians who've been using that psychotherapy. So whatever is published, the bright case report, it's always presentation of people who are unique and got the best result. But of course, the consult that I'm doing for other physician, it's when they failed and it's always some kind of problems. So that's why, from my point of view, as a person who is dealing mostly with negative outcome, I do see it as a type of therapy that really got away from the original classical psychedelic psychotherapy.
So, well,
From the
wait a minute. You've covered a lot of ground in a very short time. I'd
I
like,
apologize.
right. Our audience may not be professionals, and so I want to just backtrack a little bit and ask you some basic questions. Like, what is psychedelic psychotherapy, and why is it coming to the fore now?
Well, the originally psychedelic psychotherapy was invented back in 1950, specifically originally for treatment of alcoholism. And the theoretical concept was that the people who are abusing alcohol, hardcore alcoholic, when they develop alcohol delirium, uh, the vast majority, 99 out of 100, develop spontaneous remission. It's not necessarily forever, usually lasts 2 to 5 years, and eventually people still relapse. But still, it was very impressive that after just single,
With with a single session of psychedelic psychotherapy?
well, then the doctor who became engaged originally, right back in California, they decided to replicate it. And they started using LSD to cause the same delirium, right? So remember again, the original idea was it's not like to get person in touch with the spiritual self. At that time, we didn't really believe that psychedelic can represent transpersonal tools. It was just another psychomimetic hallucinogenic drug. But nevertheless, because of that, the intense negative visual experience basically would scare addict out of using drugs. It was using all good old-fashioned fear. It always worked nicely. When you lose mind and you become a lunatic, and it's extremely scary and uh, very unpleasant experience, and then it might waste you for several weeks after that. So that's why the it was the same, like I know. I am glutton and suddenly I'm diagnosed with cancer and I'm realizing that I caused myself gluttony irreparable harm and now it will take me to the grave and I'm scared and now I'm ready to abandon my unhealthy behavior. So, so old fashioned, we believe that fear work much better than love. The love enable those, addict, they will drug from you, but when you scare them, they right away behave very nicely for 2 to 5 years. And when when originally they started doing it, they on purpose tried to do experience frightening, right? When the Krupitsky started working with ketamine, initially he was doing it as the technique itself was that it was negative affective reinforcement that you're enduring. It's like the desensitization that you trying to cause pain, but it's under control pain to reverse pain pattern. So, for example, when he started doing it before administering people ketamine, he also would administer them apomorphine, which is like emetic, specifically to
It
cause
makes
the
you throw up.
yeah, right. So then, they would throw up and he would do like negative reinforcement that that's alcohol. And his results were beautiful. Uh, it was a nice recovery. However, he also noticed that some people, they instead of getting frightening experience, they're getting, positive, euphoric experience, instead of seeing demons and Lucifer, they see angels and God, and it looks like they also responded well and stopped drinking. So that's why he not necessarily started attempting to induce negative transpersonal experience. He just tried to induce transpersonal experience. whether it's negative or positive. He never done study to show which one worked better, that although when I discussed it with him last time, we both come to agreement that it does seem like the negative experience works better than the positive experience, but officially it's never ever. And since the United States, no one loves negative experience, and we all love the euphoric experience, so that's why that the positive psychedelic psychotherapy became significantly more popular than the frightening, that
Interesting.
experience.
So you, as a therapist sitting with this person, can guide them into either a fearful experience or a good one. Is that true?
Um,
Or it
well,
happens how it happens?
we not in the United States.
Ah,
You're the opposite.
we're not
In
allowed to
the
do that.
United States, I would give person choice. You have two choices. The one, I will do my best to induce the most frightening experience you ever had in your life. It will scare shit out of you, and your addict will recover, and from now on it will be clean life. Or if I will get you the most euphoric experience that you ever had outside of Grateful Dead and psychedelic, but it could be very like not even 50-50, one chance out of three you recover. 9 out of 10 people still will get that the positive experience with low rate of recovering than the negative experience with high rate of recovery. And I
Interesting.
guess it's because we are trained to seek nothing but pleasure, everything what negative. I noticed that here in the United States of America, word like sacrifice or commitment, they are negative word. They're bad word, we're unwilling to sacrifice, we're unwilling for commitment, we just want to go with the flow and to get as much fun as we can, and then we'll see.
Well,
Well, needless to say,
that's true. So, in case people don't know, your accent is a Russian speaker, right?
it
You're
is
from
Russian.
Ukraine or Kazakhstan, or is one of those. One of-
Uh, I was born in Ukraine and I was raised and educated in Russia, so both languages are. In fact, Ukraine is my second language, and Russian first, Ukrainian second, and then English in third. But
Sometimes.
by now, when I listen to Comrade Zelensky, I can understand 95% what he is saying, but I cannot speak myself.
Well, I'm sure the language has changed too in the interim. When did you come to this country?
I applied for the reunification of the family back in '79, and it took me 2 years to get out of the Soviet Union, and I landed in the United States of America in '81. My first place was beautiful San Francisco. It was not as hippie like in '60s, but still
It's still
you go.
pretty hippie-like,
Okay.
even today.
But
Wonder.
it still was very entertaining.
Uh-huh.
It was like the last free city on the earth,
Mm.
and it took me 2 years uh, to improve my English and to pass my medical exam. And once I accomplished it, then I got myself residency training in Houston, Texas, where I finished my residency training and then worked for 1 year for the University of Texas at Houston, and eventually moved to Florida. I got here fellowship in geriatric psychiatry in '89, and since then I've been a Floridian. Uh,
And I thought we met earlier than that, but apparently we couldn't have. But I'd feel like I've known you all my life. And so once you got to Florida, is that when you started doing psychedelic therapy here, or had you done it in in Europe as well?
no, I never really tried psychedelic while being back in the Soviet Union since they were particularly prohibited. Uh, but I did try LSD when I get here on my 33rd birthday
Ah,
as a gift, right? So And I was very impressed. I had out of body experience, became energy being, zap out of my body, and for next several hours was zooming around galaxy, being free and infinite, and it
And
was
knowing everything.
wonderful experience. I remember that returning back to the body, it was like, what that? How I can operate with those, pseudopodia, Right away, I took another 100 mic of LSD. Nothing happened. I didn't really want to come back. Uh, and that gave me a lesson that actually, thanks to God, LSD has acute tolerance and you cannot repeat it until 5, 7 days later, uh, which is a good thing. But I was very amused by the whole idea of that out of body experience and out of body travel. But it didn't really attract my attention as a healing agent. It was, fun, loving. And from that point of view, I started using LSD from once a week to once a month, almost always in the company, either with my wife or, once a month we would get party and invite our close friend, and would get LSD all together, 8, 10, 12 people, regress to the childhood and talk with the plants and it was good kind. But never, ever, right? I've been doing it between age of 33 and 40. Never, ever had any mystical experience or transpersonal experience or near-death experience. It always was out-of-body experience. Very pleasant, very, entertaining, very desirable, but I didn't really find that it has much transformative value. It was just nice way to escape from reality over weekend, and then back to salt mine on Monday. But then when I was 40, that's when I had my first the transpersonal experience, near-death experience, which is also was very frightening experience. And the reason what happened that by that time I already was 40, and by that time I already inspired to quit alcohol. Because when I was 37, I was diagnosed with colonic cancer. And when I started, and before that, I really didn't pay much attention to all those cancer. But here I'm looking and reviewing what caused colonic cancer. And to my horror and disbelief, I'm discovering that it's my three favorite drugs: alcohol, sugar, and fat. So here I, I became inspired to quit alcohol because now in my mind, the benefits are very little. I develop high tolerance. I'm having, those hangovers. The fun is gone. Meanwhile, I already got one episode of colonic cancer, and if I will continue use alcohol, it definitely, will be slow suicide. Maybe not even slow. Uh, the and so I've been like started going to all those the recovery group and started going to some counseling and and I would become sober for few weeks, but then relapse and relapse and relapse and relapse. So it became like uphill battle with superior enemy. I realized that although I help thousands of people to quit alcohol, but I'm powerless, that I'm alcoholic and nothing I can do about it. So when I was 40, right? So now, by that time, Soviet Union already collapsed and border got open. And one of my favorite cousin came to visit me for the first time from the former Soviet Union. Uh, like me, the nice Jewish guy from that Kazakhstan where we lived together, a bit younger, a few years, also a physician, he was OBGYN. And so he's coming to me, well, it's my first year in Tampa, and and right away I would like to share with him good news. And tell, hey, Alex, I got that the Philosopher's Stone, it can like it's almost like telescope into the in the universal mind or microscope in your personal mind. You have to try it. So now we decided to try it, and it's nice Saturday morning, and we got up in the morning. And my philosophy always was to take it in the morning on empty stomach because then the high is higher, and it lasts longer, and vision seems to be more intense. So we took 100 microgram of LSD, uh, and he started getting anxious. I'm realizing that he's very, that having high anxiety level, nice Jewish boy, tripping for the first time. And and he, that, oh, I'm dying. I'm, well, Alex, you're not dying. You're healthy like a horse. It's just that initial dissociative state that lasts 45 minutes, and that's when we have anxiety. I wish if I would have like diazepam, or shot of Ativan, I would shoot you up and everything will be hunky-dory. He thought, oh, good idea. Oh, first of all, he started arguing. How do you know that I'm not dying? After all, drink, I'm ready. I'm real doctor. Meanwhile, you just hit doctor. So I realized that trying to argue with another doctor, it's like,
I've had that experience, yes.
I'm sure that you had that experience. Well, doctors know everything, right? So that's when I told him that I would like to give like some lorazepam or diazepam. So I have even better. I bought the Stolichная vodka from Mother Russia. Let's have it. Will be like quicker absorb. So, well, good idea. So we're getting shot of vodka. But in Russian tradition, you never stop after one shot of vodka. You have to have three, right? One for body, one for mind, one for soul. And then number four on the road too, right? When you're separated. So we're having three shots of vodka, and right away he's feeling better. He's feeling better, and by now he started entering the hallucinogenic state. Uh, but meanwhile, by that time I already didn't drink vodka for 3 years because at least I cut down to wine. So instead of drinking hard liquor, now I glass of wine with dinner, as the sophisticated, cultured, civilized man. Uh, but here after 3 years, I'm getting three shots of vodka and on empty stomach. So now I'm getting really sick. So I fixed him the bubble bath and get him and later on he told that whole 8 hours he was sitting in that bubble bath playing with those bubbles. He feel like he is Ali Baba in some kind of treasury. Meanwhile, I excuse myself, got into my bedroom and crashed there. Oh, it was my like the worst terrifying trip I ever had. I I had near-death experience, and I'm departing because I thought that I poisoned myself with alcohol and I'm dying from alcohol intoxication, and it will be disgrace for my family and for my friends and for entire Jewish race and maybe for the entire Milky Way galaxy. Uh, but uh, but after I died, it was my near-death experience, right? It was all related to alcohol consumption. It's like I started drinking at 16. By my early 20s, I already been drinking heavily and started having all those blackouts, and all those rude awakening when I wake up in my own puke, with a terrible headache and watching my mother staying in the door with her arms across against the street and looking at me with disgust, like you're a disgrace for the entire the Jewish race. You're the only Jewish I know who is alcoholic. Somehow she believed that Jew cannot be alcoholic.
That's not true.
And so it's all like my entire alcoholic history, between age of 20 and 40, all those 20 years were compressed in 2 hours, and it was nothing but all those blackouts and hangover and fight and making ass of myself and insulting other people. And not only that, but here for the first time, I started seeing it like from the transpersonal point of view. Not only I see my own trespassing against my friends and parents, but also I see how it, you know, a ripple effect, that I make them angry and then they dump their anger on someone else. And so after that experience ended, I look at myself like, damn, I am like just disgraced alcoholic, and I sentence myself to the hell. And then I spent in hell another few hours until experience got over. After that happened, right? And again, remember, it was no psychotherapy, no preparation, just the frightening, negative, disgusting experience of looking at my own alcohol history, but from the third party objective point of view, kill my alcohol craving on spot. For next 20 years, I have no craving. Between 40 and 60, I didn't use alcohol. I use other drugs, like LSD
That's
and
right.
pot, but alcohol became, like,
That,
and that's when I realized, damn, the drug is not just the euphoria that can get you high for, 8, 10 hours, but it's also great, like I've been doing conscious effort for 3 years to stop alcohol, and I try all that available, like counseling and psychotherapy and 12 step and, personal therapy. Nothing work. And here it's just one dose of LSD, and 8 hours later, I wake up and all my craving gone, and I have nothing. So that's when I started now looking for the therapeutic application of, and that's when I learned that, oh yeah, LSD has been used for treatment of alcoholism since
wasn't it
1950.
Bill W., the guy that founded AA? He did recommend LSD in the beginning, but they took it out of the protocol, obviously.
Right, right. Well, after all, our politics and medicine, it's run on in opposite dimension. It's
Yeah.
it's very frustrating, right?
We're
That
not allowed to open our minds. That's dangerous for the status quo. That's what I believe, that these psychedelic drugs are not dangerous for the individual, but they're dangerous for the culture and the society at large that is a repressive society.
Well, that's exactly the point. That is dangerous for repressive society.
That's
If
right.
it would be egalitarian, progressive society, we would welcome psychedelic, we would implement something like Eulogian field and encourage, any American citizen to undertake, for growth and, But unfortunately, I agree with you. We are very repressive society. Although we talk about freedom and democracy and responsibility and love, but
Then
but
and then
we're
outlaw plants and we
right.
outlaw substances that are even made in our own bodies for
That's right. Well,
make
it's
it.
another good point that again, 30 years I spent in communist Russia, and then another 40 years in the capitalist United States of America. In both countries, any uppers and any downers are completely legal, either for prescription or for over-the-counter consumption. Psychedelic, illegal. Whether it's the communist Russia, whether it's capitalist America, whether it's the atheist China, or whether it's, the religious Tehran, but they all prohibit psychedelic. So
So,
clearly,
yeah, I was going to say all indigenous cultures make it a part of their communal rituals. From the Aborigines in Australia, the tribes in the Amazon, the Greeks even had their psychedelic rituals, and yet our culture doesn't allow it. So let's not go too deep into that because we're treading on thin ice here. And I would like to go on and have you explain more. If you had your choice of any psychedelic substance to use in psychotherapy, which would it be and why?
well, again, from my point of view, as a person, right, I try. I don't know, maybe a dozen of different psychedelic, clearly the LSD and mushroom and, ayahuasca and peyote, salvia, and maybe half a dozen of the uh, designer, DPT, DMT, uh, but I would, in my opinion, right, different psychedelic give me about the same variety of experience.
Ah,
And in the same time, I never had the same experience on psychedelic. I would have LSD experience and then I would like to replicate it. And I do everything absolutely the same, the same ritual, the same dose, the same music, the same, uh, entirely different experience.
Mhm.
So from that point of view, to me, it's whatever psychedelic I have, I would work with that. But today, it still will be ketamine.
Mhm.
Why I like ketamine? Because as I saw that, unlike, the classical psychedelic that, psilocybin can last 4 to 5 hours, LSD, 10 to 12 hours, and we basically stuck in the same room with the patient for whole bloody day. And it's it's not good. We're supposed to see 10 patients a day, not one patient a day, right? So
So
otherwise,
ketamine lasts an hour to an hour and a half, and you don't talk during the experience. That's another thing that's quite different. So,
well, again, if you will do it as a psycholytic psychotherapy, right? So as of right now, it's movement sleep. Like the majority of people, again, when I met with the people, with practitioners, they were somewhere from New York area, three were from Alaska, from the Baltimore, from a couple southern state. So it was a nice example of people who are using that, right? 20 people, virtually everyone using it repeated doses of low doses. Even when they use psychedelic doses instead of getting, like for ketamine, when we talk in injection, right, injectable dose between 25 to 50 milligram of ketamine doesn't give you any visions. It's basically like super alcohol. It's like Xanax. It's very nice. The mind chattering mind stop. All I feel is feeling of love and compassion to self and other. So it's a wonderful condition. And and now psychotherapists use that condition specifically, if you're traumatized or have PTSD and you're scared to talk about your trauma, whether it was assault or rape or some other atrocity. But here, because you're nicely stoned, you can talk about your trauma, and we all happy about that and doing that the when we increase the dose, right, then the crossover between the empathogenic effect and psychedelic effect is around between 70 and 80 milligram IM. So if I will get, 75 milligram, 50% of people will get empathogenic, but 50% will start hallucinating, right? So the doses, when we use higher doses, let's say 90, 100, they will induce the out-of-body experience. If we go and continue to increase the dose, and now we go to dose 130, 140, 150, then they can induce near-death experience. So then majority of people, when I talk with them, they all using either the empathogenic doses
mhm.
repeatedly, once or twice a week, sometimes 3 times a week for few weeks, and then continue to keep it as a maintenance forever. Or if they're using hallucinogenic dose, again, they do it around 100 milligram. They don't like to go to cause those near-death experience. First of all, no one wants to scare our esteemed customers because they don't like negative experience, and two, then it will turn customer away from me, and then customer will be lost forever. It's totally unacceptable. So that's why I noted that out of 20 practitioners out there, 19 continue to use repeated low doses to uh, untie your tongue. Well, I personally don't see big. After all, in the beginning, we all use medication for that, psychosynthesis, that we will get low dose of barbiturates or low dose of, alcohol or low dose of benzodiazepine, and it will have the same effect. It will decrease anxiety and people can start talk about the trauma. And I used to work as a bartender for a couple months back in the Soviet Union. And I quickly noticed as soon as you offer people few drinks, they will spill everything to you. Uh,
So that's
of
what
course,
you're looking for.
of course, next morning, they wake up and don't remember nothing, easy come, easy go. So to me, it's the same here, that we are using those lubricant, to untidy talk, to create them that nice mushy experience where they can talk about their trauma and being totally supported, and it will make them feel better for a few days, but then anxiety come back, so they come for next session and next session, but eventually it stopped working. Like I have, in fact, I have several cases where I was following myself, for several years as a consultant. Like one of the case that especially impressive, it's uh, the woman who was terribly mistreated when she was child. Her mother truly was a psycho bitch, vicious, punitive woman, and father was passive, non-available, never protecting her from mother, and so she raised basically like, and again, mother was not physically abusive, she was just very punitive, like psychologically punitive, Uh, and I recommended her that psychedelic psychotherapy 6 or 7 years ago. But she's in Boston area, so she didn't really want to come here at all. Well, in Boston, there are plenty of, at that time, I didn't know that majority of them specializing in this, that the in pathogenic rather than psychedelic therapy, right? And so she started, and in the beginning, and once or twice a year, we would still have like Zoom because I was curious and keep eye on her. And that euphoria, initial euphoria lasted 6, 9 months. And by now it's all the same, she's getting her lozenges by mail from Boston. She's, like hour away from Boston, so she doesn't want to drive there. And then session conducted through Zoom. And she take your, the ketamine lozenges and therapist play music on TV, for 45 minutes. And, well, for past year, it stopped working.
Mm.
It stopped working and anxiety coming back because after all, cause still has not been eliminated and she still didn't transcend that. But from the uh, reimbursement point of view, of course, it's much better, right? The people who come to me for that near death, rush, treatment with all that intensive. They recycle through the treatment, and then I will never see them again because they all heal. Now they don't need me. But those on the low dose psycholytic psychotherapy, yeah, the customer will continue to come to me year after year after year until I die or she die, whoever die first. So that's why I think that the true reason why the psycholytic psychotherapy became so popular because of money. It's not because of effectiveness. And because it's easy, there is no hallucination, there is no panic attack, there is no agitation, there is no need, for, you can do it like remotely, send them lozenge and play them, some elevator music, and so
Well,
it makes.
okay. So you don't really see a long-term benefit with low dose, but
Well,
high
I
dose,
see.
yes.
I see indication that there are some people, especially those who have PTSD, especially for domestic abuse. It's difficult for them to start talking, and initially it may have some benefit, but repeated users don't necessarily resolve that abuse. You still have to reset the mind. So to me, it's almost like, instead of electroshock therapy, it's chemical shock therapy. You just flood the brain with all those chemical, induce some, intense visionary experience, reboot the entire nervous system. So to me, that the healing effect that you just reboot it all, because trying to analyze it. In fact, when I started doing, I didn't start doing that as I mentioned, between 33 and 40, I was just using it for recreational reason. And then between 40 and 42, for 4 years, it's when I joined Native American church and, started going to all kind of shamanic ceremony. Well, we did it together with you quite a few times, getting all those Peruvian shaman and Ecuadorian shaman and, the American shaman from the Southwest. Uh, and
Ah,
oh,
there's Luna. I know
go,
Luna.
go to mama, go to mama. See, when she need to go, she right away come to me. Mama, go to mama, mama. Okay.
Okay, let me pause this for the.
Okay, so what I'm saying that during that 7 years that I used LSD recreationally, I had lots of beautiful moments. I enjoyed very much, but from point of view of that like growth or resolution of my problem, I didn't find my same like smoking pot. give you give you lots of nice and mushy feeling, but not necessarily will make you a better person. Well, except that you're calmer when you're stoned, you're not kicking your dog, you're not screaming on your kids, So it has benefits, right? So when I started doing for that day, like now for spiritual reason, right? So now I'm going to all those sweat lodges and all those ceremonies and doing it. And again, experience change. Now I'm having, instead of all just silly vision, talking with the spiders, and I'm having that the awareness that universe, it's a living being, that the universal mind, that's part of that universal consciousness, and we're all interconnected. So again, it was wonderful, and and I started having delusion that now I truly know God. But from the personal point of view, again, not much change. It's only when I started using it, specifically, not just the experience itself, but that preparation, identification, psychotherapeutic work, only then I started noticing improvement. So in my mind today, it's the same when I say that psychedelic assisted psychotherapy, emphasis on psychotherapy, the psychedelic, they just assisted for psychotherapy alone, I don't think they will. Occasionally, they can cause transformative experience, like happened with me on couple occasions. Uh, but in real life, you have still to do work. It's, you
Well,
know,
I guess there's no easy way out of this life. And if we want to change, we have to intend it and we have to work at it.
Good point. Otherwise, it would be too arrogant to think that you can drop some molecules and
Yeah.
suddenly it clear your mind, clear your
Well,
soul, clear your body, and you're holy man or woman.
I think it can in certain circumstances. I think that what it can do is put your small self in a larger context. And when you can see that larger context, then the small self loses a lot of power, its power to constrict you and to keep you inside your head, inside this small body. It gives you a glimpse. So for me, I saw myself outside the planet. I could read minds of the tiny ants that were running up and down. It was the East Coast I was looking at. And every one of them thought that they were doing the most important thing in the world. And I thought that was hilarious. And I laughed and laughed for hours. And then I thought it was pathetic and I wept for hours and I went back and forth. And when I came back, I could never take myself as seriously anymore. It just seemed I was one of those ants.
No.
So
Well,
the
I agree.
was gone.
After all, those near-death experience and those transpersonal experience that on occasion that can be happened, spontaneously. And then we know with the studies, let's say, on that the people who tried to commit suicide but unsuccessfully, we also learned that some of them had that near-death experience, some didn't. And those who did have near-death experience, in fact, they stopped trying to heal themselves. But those who didn't get it, they continue to be suicidal. So clearly that experience itself can be healing. Well, in your case, I would argue that you didn't just do it. After all, when you started using it for spiritual purposes, it was done in the framework of the spiritual gathering and some kind of theoretical preparation. I remember we
That
would
was
get and
much later. That was
meditate.
much later. This was my very first psychedelic experience. I was 19 or 20. It was LSD. I knew nothing. I had no preconceptions. And that's what I got. So luckily, I think I was very fortunate to have such a beneficial, mind-blowing experience. So how do they compare with, say, SSRIs or anxiolytic drugs? How would you place them in that pharmacopoeia, the psychedelic?
Well, uh, my original training back in the Soviet Union was strictly as a psychopharmacologist. And I truly believe with the right combination of right drug, I can heal everyone and everyone will be happy eternally, walking on water and, parting the sea. But it took me about 20 years of pushing all those psychotropic medication before I learned that they control symptoms, but they don't resolve the root of the problem, and they don't control symptoms forever. That after a while, majority of people develop tolerance. Those who are lucky, it takes them 2 to 5 years before they develop tolerance and become non-responsive. And those who are not that lucky, sometimes 6, 9 months of remission, and after that, a chasing tail. when I used to work as a psychiatrist in the former Soviet Union, the number of people who had chronic treatment-resistant depression was less than 4%. Today, it's over 40% and growing. Well, when we started using antidepressant, it's always been depressant limited, right? Even if it's first episode of depression, after all, remember that the original antidepressant, MAO inhibitor and tricyclic, they were very potent. They had lots of side effects. So we wouldn't use them indiscriminately. We only use them when it's severe depression, like the old was that you don't even do until that back inventory score at least 25. Now people start on antidepressant Prozac when it's 16. On 16, I wouldn't even send to psychotherapy. To me, it's situational. And it's always was time limited, that if it's first episode of depression, I should stop it after 6 months and then, get the drug holiday for 6 months to see how it works. If it's recurrent depression, still after 1 year, even if it's chronic depression, after 2 years, I'm supposed to stop. If I would use antidepressant indefinitely, they would put me to the wall to face firing squad and take away my license, like committing malpractice and just being brute and rapist. Well, now it's opposite. It's opposite. You start the antidepressant and there's assumption that you will take it until you either die or it will be thermonuclear war and no longer Prozac available. Well, needless to say that now we have, instead of 4 out of 100, we have 4 out of 10 who have treatment-resistant depression. So what is the cause of treatment depression? Well, chronic use of antidepressant without proper psychotherapy. The antidepressant, they don't heal anything. They just control symptoms. It's like I'm having diarrhea and I'm taking cow pectate. It does work, but
It
if my
doesn't.
diarrhea caused, by some infection, it will kill me.
But
Even
fewer and fewer psychiatrists are doing talk therapy anymore. They don't talk to their patients, they just prescribe for them.
Good point. When I left Soviet Union, right, in the Soviet Union, the residency training in psychiatry was only 2 years. And it was strictly inpatient psychiatry. It was the same like first 2 years of psychiatry training here. You just recycle from one inpatient unit through another inpatient unit because the idea is that the more severe psychopathology, the easier it is to learn, and then you can pick up everything on outpatient basis. Psychotherapy outpatient was only 2 months. So
Wow.
when I got here into, yeah, well, it was, the one month for hypnosis and 1 month for the cognitive behavioral therapy for neurosis. Uh, because we all consider it's all psychopharmacological, it's all chemical, all that is just few chemical reaction by couple chemicals, easy to do it. Well, when I came here, right, I was very impressed. To me, it was not just repetition, because here it's 4 years. And again, first 2 years are the same, inpatient psychiatry, but after that it's nothing but outpatient and long-term psychotherapy, and I'm encouraged to recycle through psychotherapy as recipient, So I was very impressed. I was, damn, look at that, while back in Mother Russia, everyone is biologically oriented. Here, people are psychologically minded, They don't really think that mind is like flatulence, some kind of epiphenomenon of working brain. They treat it as a, phenomenon. Well, today it's all upside down.
Mhm.
When I visited back in 2017 Russia, those transversal society are everywhere,
Mhm.
everywhere. I'm here. We're all biologically minded.
Yeah,
Everyone believe in that
materialist.
chemical imbalance. Well, I shouldn't say that everyone believe. When I talk with the other psychiatrists one-on-one, no one believed that you can reduce everything to chemical imbalance. Everyone agree that it's just the advertisement of those big pharma. They invented nice selling point. So every American citizen convinced that they have chemical imbalance. Even they don't know what imbalance and what kind of chemical, but they know that they need Adderall and Xanax, to treat the chemical imbalance.
It's
Uh,
like Alice in Wonderland. The one side of the mushroom makes you calm and one side makes you excited. And so you balance that.
well, I notice it, and most likely you notice the same, that it's all started after, it was 97 or 98 when Congress allowed pharmaceutical company to advertise directly to consumer and allow them to start teaching physician, nurses, and veterinarian. And that's when all hell got loose.
Right.
Because then, for past quarter of century, basically we've been educated by big pharma. It would be the same, you're popular nutritionist. I go to you and you recommend me the diet of the hamburger, Coca-Cola, and French fries. And only then I learned that you finish university in McDonald's.
Exactly. So,
Yeah, so it's ironic. That's why, those former atheists and communists now they're more transformative than we are, and we are who were, all that psychodynamic psychotherapy and long-term psychotherapy and insight-oriented psychotherapy. It's all chemical imbalance. We have pill for every ill.
do you find that psychedelic psychotherapy falls into that category? Would you say it's better than the drug therapy or the same, or ultimately it doesn't matter what you do?
Well, again, from my point of view, that the psychedelic psychotherapy is definitely can reset mind. I cannot claim that it will help 100% of people. My best score, it was, 7, 8 out of 10. 2 to 3 don't respond no matter what. You will show them burning bush on Mount Sinai. It will not impress them either. They will still be. But, 7, 8 respond. You know, in terms of psycholytic psychotherapy, again, it's like regular pharmacotherapy. It work well on the front end, but then, after say, 9, 12 months to 5 months, it stops working. And then you just increase the frequency, increase the doses. I can share with you one of the first cases I became involved, back in like the beginning of 2000, where uh, there were very small number of clinic. They just started, by 2010 we have about 100 clinic. Now we have over 12,000 clinic. Well, out of that 100 clinic, 90 were doing nothing but just either infusion or the low dose. And less than 10 specializing in psychedelic psychotherapy. Well, one of the local, in fact, it's in Sarasota, and he's still here. It's anesthesiologists who are shooting, his people with that IV. I got from him lots of patience, because he didn't know what to do there. I remember one was, the young woman in her, let's say, late 30s. And when you talk to her, clearly all her, neurotic because of her life, her husband abusive, kids are mental unstable, lots of trouble, with the psychological abuse and neglect. So she had good reason to have headache. So she had migraine headache, So he started treating her with ketamine and gave her the like infusion, not infusion, but
Table
insulation,
spray.
intranasal, right? 10, uh, 10 milligram 4 times a day, right? Right away, it control her migraine headache on the spot, right? Now, the 9 months later, she's already taking 100 milligram 6 times a day. 600, not never had psychedelic experience whatsoever. Possible tolerance, right? So now she's gobbling that 100 milligram of nothing, So, and not only that, but now the headache started getting worse. So he's panicking. What to do now? I told, well, detoxify from ketamine and get her back on whatever you had before, what you can do. Then from his another patient was, so again, that's when I learned that when you treat psychosomatic problem without psychotherapy and relying only on psychiatric effect, sooner or later will develop tolerance.
Yeah.
Right? After all, why it should help? Then another episode, it was he had the Hispanic man, I think early 60s, right, who had long history of depression, and by that time it's already treatment-resistant depression because he has been on antidepressant for more than 20 years. But now on the top of that, he started developing Parkinsonism. Well, needless to say, it's not good combination, right? So now he's not just depressed, he's suicidal depressed. So that the anesthesiologist assessed him and told, well, he's good candidate for an infusion. He gave him an infusion on Friday morning, right? And right away, it eliminated all the suicidal ideation, all depression. In fact, man became mildly hypomanic, And that hypomania lasted through Saturday. And he already had another appointment for Monday for next injection, right? But on Sunday, he got back. And like when you live in the hell, you got accustomed to the hell and you can tolerate hell. But when I lift you to paradise, for 24 hours, and then throw you back in the hell, man got in his car and they got into the ditch and killed himself.
Right.
Uh, and I remember that the anesthesiologist was very alarmed. Well, luckily, the relatives never initiated lawsuit against him. But I hope you learn your lesson that depression is not like diarrhea. You cannot just give Pictate and send patient home. It's a serious mental condition, very frequently, lifelong. You have to. And it's not necessarily biological. People, do have losses and trauma. It's just human being.
Yeah, life
Look
happened.
at that breast here.
Huh. He's still
He
at
just
it.
he stopped accepting people with depression for ketamine.
Wow, that cut back his practice quite a bit, I imagine.
Mm.
Wow.
So
Well,
so today, 30 years later, I feel disappointed that, we got the like that the greedy profiteer, right away. Like when you look at that, the mind bloom, to me it's mind boom, they're sending pills and they're sending that as 500-600 milligram pills. I think they don't count the weight of ketamine, they count how much a pill weigh. Because
crazy.
they're sending those loaded syringes and not pill, it's become just for profit, we can take the elixir of youth and still convert it in some kind of addictive drug.
Well, it's all about set and setting, I guess, in the medical profession, as well as the single experience. So we've been talking for an hour, believe it or not, and I very much appreciate what you've had to say. And when we start getting our feedback, we're going to post this video to our YouTube website, Grokking Wholeness, and our website, grokkingwholeness.info. And we invite our listeners to subscribe, to like, and to share, and keep us going and give us your comments because Dr. Kolp can come back. I know he can. I know where he lives.
Well, I should tell you that I tried to access the website. It didn't get me. It was some same like other people complain that they get either to the wrong page or it was inaccessible. I had the same problem.
I'm sorry. Did you get to our website? Did you find it?
Well, when I try to access it through the link that you sent to me,
Well, I'll send you another one. Maybe I
yeah,
missed.
yeah, he sent it to me, so then I will
I
try it.
will. And then I thank you for your time and your expertise and your very entertaining stories. And I hope our listeners aren't totally freaked out by some of your stories, but it's true. We have good and we have bad. Is there anything you want to leave the listeners with in terms of your ultimate wisdom and many years' experience? Do you want to share something else that I may not have asked?
My main message is the same that the psychedelic without psychotherapy, it's fascinating drug, but and it can occasion spontaneous remission. But if you want to do it as a tool and to increase from occasional to ongoing, it must be done with psychotherapy.
Okay.
We cannot avoid it, as much as it desirable to save money and time on psychotherapy, but
There's no
it,
shortcut to
right,
that.
easy in, easy out.
But as a community builder and a social lubricant, I think it's a wonderful tool. And
Oh, absolutely. I think it's better than alcohol,
much better, yes.
better than alcohol and less dangerous, more positive, create. In fact, if I would become emperor of next empire, I would outlaw alcohol and sugar and legalize LSD and
Well,
psilocybin.
okay, you just lost my vote. We don't need any more emperors than we already have.
Well, that's true. Absolutely.
All right. Well, again, thank you so much. And I will see you soon and appreciate everything that you've shared with us. And we need to do this again.
We're getting together this Saturday, right? We have the next.
Yes, so we don't
Yeah.
have to share
Well,
everything.
I'll see you on Saturday.
Thank you. Bye now.
Okay.
Uh-huh.
Have a wonderful day and enjoy yourself. Be
Okay,
well.
you too. Shalom.